Axial spondyloarthritis and ankylosing spondylitis. Definition: axial spondyloarthritis is a chronic form of arthritis that causes significant inflammatory low back that affects the bones and joints at the base of the spine where it connects with the pelvis. When the disease is active, these joints become inflamed, may be diagnosed as either ankylosing spondylitis or non-radiographic axial spondyloarthritis, depending on the presence of radiographic cyclitis. Ankylosing spondylitis is a chronic inflammatory disease with a special characteristic. Over time, it can fuse vertebrae together, limiting movement. The disease is more common and more severe in men.
1 in 200 people in the UK have ankylosing spondylitis, otherwise known as axial spondyloarthritis, or just AS for short. But not many people know about it. AS is an inflammatory arthritis that mainly affects your spine. Inflammation occurs around your spine where the ligaments or tendons attach to the bone. It often starts at the bottom of the spine in the sacroiliac joints, but can happen anywhere in the spine. Over time, this repeated inflammation can lead to further bone formation. The individual bones which make up your backbone, called vertebrae, may fuse together. This inflammation causes pain, stiffness, and high levels of fatigue. It can vary a lot from one day to another. Sometimes the inflammation will die down and you'll feel less pain and have more energy. Other days, your AS may flare up and you'll have a lot more pain and difficulty moving around. It will be harder to get on with your daily life. Medications to reduce the inflammation and stretching exercises can help your AS. NAS is backing you with your AS. Join as a member by visiting www.nas.co.uk.
Application in medicine. Quality of life can be improved if people with AXPA get treatment from rheumatologists, medical specialists who have been trained to diagnose and treat the disease. Axial spondyloarthritis is often misdiagnosed or not diagnosed for several years after a patient first experiences symptoms. Early diagnosis is essential for optimum patient care. A diagnosis of AS is based on your medical history and physical examination. You may also have imaging or blood test.
When I woke up today, I was in so much pain that I couldn't move a single inch of my body. At the same time, all I wanted to do was move so that the pain would stop. It took me 10 minutes to finally get out of bed and 10 more minutes to reach the bathroom. Every time I moved a leg forward, I screamed. Not like a human, like an animal. I walked to university a centimetre at a time, holding on to everything I could find in the street. University's really lonely. I don't get the chance to socialise with other students because it would take me the whole break just to get to the cafeteria. I can't sleep because of the pain. Lying down is the worst. My joints are pressed between the weight of my body and the pressure of the mattress. Even exhaustion isn't enough to make me sleep. What I didn't know is that this is going to get harder and harder every day. And I know that tomorrow's going to be just the same. I've had the same tomorrow for 8 years now.
Pros and cons. Symptoms of AXPA can have a major impact on quality of life. The pain and stiffness caused by AXPA can limit the ability to work, socialize, and exercise. It affects men and women, with men generally experiencing a more progressive form of the disease. However, women experience greater negative impact on quality of life. A number of treatments are available. The selection is tailored for each individual based on the characteristics and severity of the disease. There are many ways to prevent by associations.
Ankylosing spondylitis, otherwise known as axial spondyloarthritis, or AS for short, is managed by a combination of exercise and medication to reduce the underlying inflammation and pain. Physiotherapy and regular exercise can have a big effect on the outcome of your AS. Key benefits include improving your general well-being and range of movement, decreasing your stiffness, and helping you keep good posture. A physiotherapist can teach you the correct daily exercises and stretches for your AS. NAS have more than 95 branches around the UK where you can have regular group physiotherapy. Low-impact exercise, including walking, swimming, and Pilates, are ideal for AS. Try to pick something you enjoy, as you are more likely to keep it up in the long term. Encourage friends and family to get involved too. NAS has developed an exercise program called Back to Action for people with AS who want to exercise safely in the gym. A guide is available on the NAS website, or you can download the app for free. Medication is used alongside exercise to help lower inflammation and reduce pain. Your GP or your rheumatologist can prescribe non-steroidal anti-inflammatory medication, also known as NSAIDs, to help. There's a huge range to choose from, so if one doesn't help, it's worth asking to try a different one. If NSAIDs don't help or you have side effects, you could talk to your consultant rheumatologist about being assessed for biologic medication. There are two types of biologic therapy available for AS: anti-TNF therapy and anti-IL-17A inhibitors. NAS have a free guide to biologic therapy. Research has also found that smoking can make your AS worse and can reduce the effect of biologic therapy. If you are a smoker, please stop or consider getting help. NAS is backing you to manage your AS. Join as a member by visiting www.nas.co.uk.
Issue applied in Ecuador. All patients should receive physical therapy and exercise to strengthen the joints. The pharmacological treatment is mainly based on the use of non-steroidal anti-inflammatory drugs, which should be taken regularly or when necessary. Anti-TNF biological agents are extremely effective in the treatment of ankylosing spondylitis, resulting in rapid improvement of signs and symptoms, and a starch-free diet. In conclusion, it's important to know more about various cases of the disease, study the possible genetic causes, and establish the correct treatment for these people in addition to guidance. In turn, explain new ways to prevent those who are unaware of the disease. Thank you.